Welcome, everyone. We'll get started in just a few moments. This is the first Missouri Open Door Benefits Mod for the new year, 2026. I just want to give everybody a chance to get logged in and settled. Welcome to the Missouri Benefits Mod. We are supported by the Medicare Improvement for Patients and Providers Act, which is MIPA, Priorities 1, 2, and 3. And it's a partnership between Missouri SHIP, Missouri Department of Health and Senior Services, and the University of Missouri Kansas City Institute for Human Development. Missouri No Wrong Door, our goal is to transform the way people access services in their community as we support individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and supports regardless of age, income, or disability. The Open Door, our goal is to open doors to integrated supports, and we do this through the Missouri Open Door Technology Series, which focuses on those personal technologies everyone uses, assistive and adaptive technologies, environmental technologies, and anything else that is up and coming in the land of tech. The benefits mod focuses on those benefit eligibility specific resources in the state of Missouri. I am also admitting people, so please bear with me. The benefits mods, that series meets the second Wednesday of every month, while the technology mod will be on the 28th of this month because they meet the fourth Wednesday of each month. The slides and recording will be shared after the call, so if you're frantically taking notes or trying to remember something, know you will get a follow-up after this event today. We also want to announce that the Life Course Nexus is hosting their 10th annual Charting the Life Course Showcase, May 5th through 7th. This is a great opportunity to reflect on what has happened over the past 10 years, the growth and impact of the framework and principles as we have driven meaningful change in people's lives around the country and world. And explore how this person-centered approach helps individuals, families, programs, and systems explore, plan, and problem solve for positive change. Early bird registration was extended to January 31st, and it's going to be a great time in May. We hope to see you there. You can sponsor the showcase if you're interested in it. The call for sponsors is out. There's a QR code on your screen, or you can go to the Life Course Nexus website and download it from there as well. The QR code should take you directly to the document. We also have our call for awards out, so help us to celebrate Charting the Life Course champions. Nominations are open for those who have helped build, refine, and advance the Charting the Life Course framework. And we recognize people working around person-centered practices, supporting families, personal problem solving, community engagement, and research. Today's presenters are Christy Bowling-Demetz and Julie Peets. And I should have asked you before this call how to pronounce your names, so I hope I did it correctly. And I'm going to hand it right on over to them so they can use as much of their time wisely. Oops.
Wonderful. Thank you so much. And you nailed it on the names. Thank you for having us here today and for wanting to hear a little bit more about the Area Agencies on Aging. We always appreciate talking and sharing about the good work that we do. The Missouri Association of Area Agencies on Aging is a unified network of 10 independent AAAs dedicated to ensuring that Missourians can remain safe, healthy, and independent in their own homes as they age for as long as possible. AAAs were established in 1973, and Missouri's AAAs have been providing a legacy of care and essential infrastructure for 50 years now. Okay, Missouri has 10 AAAs covering every county in Missouri and the city of St. Louis. Each AAA is an independent agency designated by the state to assess, plan, develop, and provide services for older adults 60 and older, their caregivers, and in many instances, adults with disabilities starting as young as 18. AAAs are local experts on aging services and resources and act as a front door, a single point of entry for information, assistance, and long-term support. MA4, the association, is, as its name, is the statewide association that unites all 10 of our Missouri AAAs. Together, our AAAs serve around 150,000 older adults annually. Again, my name is Julie Peets. I'm the executive director of MA4, and with me today is Christy Bowling Demetz, who is the president of MA4 and the director of aging and adult services for our AAA in Kansas City, MARC, at Mid-America Regional Council. MARC serves Cass, Clay, Jackson, Platte, and Ray counties, and MARC is unique among our AAAs. While 8 out of 10 of our AAAs are nonprofits, MARC and our St. Louis AAA as well are part of a larger governmental entity. Next slide. This is just the map of our network coverage. Again, we have 10 AAAs. We cover every part of the state. And the AAAs are really well versed in the needs in their own communities. Because as you know, Kansas City is very different from Knoll, Missouri, and different from St. Louis. So there's a lot of differing needs and different resources across the state. And our AAAs really work to address the local needs of each of their communities. So each of our AAAs vary dramatically. I don't know dramatically, but they vary greatly in size, scope of services, in staffing, and even in names. Many people are not aware of what a AAA is because we just don't share the same name, or not even, it doesn't even identify AAA in our name. But we are part of a national structure, and in Missouri, all 10 of our AAAs have different names and different resources. Next slide. We're Missouri, I'm sure as everyone on this call knows, Missouri is facing a demographic shift with an aging population that has increasingly complex needs. Missouri, along with the rest of the country, is experiencing a rapid growth in the number and percentage of share of the population of older adults. Older adults will soon outnumber youth. And this is a huge historic demographic shift that has profound implications for us as a community. As the numbers of older adults accelerate, so does the complexity of the needs we are seeing among our clients. And among the clients that we serve statewide, 1 in 3 are at or below the federal poverty level. 2 out of 3 live alone. Next slide. 4 out of 10 are 75 and older. While AAAs serve our base, we serve is adults 60 and older. That range is a huge, broad range from age 60 to up to 100. We have people over 100. And there are varying needs, as you can imagine, between a 60-year-old and an 80-year-old. Increasingly, we're seeing people at the higher end of that age spectrum. Over half of our clients manage at least 6 chronic conditions, and 1 in 3 manage 8+ chronic conditions. Next slide. AAAs were formally established in 1973 through the Older Americans Act and are designated as the on-the-ground organizations charged with helping vulnerable adults to age with independence and dignity in their homes and communities. AAAs are part of a national and state infrastructure. At a time when government funding and services are under intense scrutiny, I just was opening my news earlier and hearing about audits in other states and people looking so closely at government spending, it's nice to know that AAAs represent government at its most effective, locally led and community driven. Our ground up design means that services aren't just delivered, they're tailored to the specific needs of the people we serve, ensuring that no one is left behind. The funding flows from the federal government OAA, Older Americans Act funding, through the State Unit on Aging, which in Missouri is the Missouri Division of Senior and Disability Services. DSDS then contracts with the 10 AAAs here in Missouri. AAAs provide some services directly and other services through contracts with local service providers, like many of you here on the call today. And as I said, they're all a little bit different, so they have different mixes of direct services versus contracts. And the one thing that all of the AAAs do is they leverage the federal Older Americans Act dollars to secure additional local, state, and federal and private funding to expand their missions. AAAs coordinate everything from meal deliveries to in-home care, often collaborating with disability service providers like many of you here. In fiscal year 2024, support from Missouri AAAs prevented early institutional care, meaning hospital or nursing home care, providing 575,000 extra days in community living. Next slide. The guiding purpose of the Older Americans Act is to support people as they age and to live independently and in their own homes, aging in place. While each of our AAAs function and vary in size and scope of services, there are 5 core services that all AAAs provide: caregiver support, health and wellness, nutrition, supportive services, and elder rights. Next slide. Under the core services, nutrition is the service that is most recognized for the AAAs. Most people recognize AAAs and associate them with nutrition, including people often refer to Meals on Wheels. We are the group that provides those home-delivered meals. And nutrition to the AAAs is so much more than just a meal, though. Nutrition includes congregate meals, and that is often associated with senior centers, as well as home-delivered meals. Both types of meals provide important social connection and wellness checks. Between our congregate and home-delivered meals, Missouri AAAs provided over 10 million meals to about 150,000 people in fiscal year 2024. Next slide. True independence is often built on small details. Beyond nutrition, our supportive services provide a vital infrastructure that bridges the gap between needing help and staying safely at home. By addressing simple needs like a reliable ride to the doctor or the installation of a grab bar, we prevent minor hurdles from turning into life-altering transitions. We ensure that a lack of transportation or a simple minor home repair doesn't jeopardize a person's right to stay at home. Our information and referral staff are just essential. They act as a front door to assist clients with navigating the complex array of available resources and supports. We also provide case management where we assess needs and connect people to services such as transportation to medical appointments and grocery stores. AAAs also provide in-home services like personal care assistance for bathing and dressing. And legal assistance includes referrals to legal assistance for issues like abuse or benefit appeals. Next slide. Family caregiver services offer and support our caregivers, often a family member who's juggling work and caregiver duties. Most of us here have been or will be caregivers at some point in our lives. We know caregivers are unsung heroes here in Missouri, and often unpaid, probably most often unpaid. The AAAs provide respite, training, and support for caregivers so they are empowered to keep it going. It is just vital to support caregivers, as you know, so that we can keep on going, and caregiving that is provided in the community saves billions of dollars in healthcare costs. Elder rights services include advocacy through the long-term ombudsman program and for residents living in long-term care. Next slide. Health and wellness services empower older adults with evidence-based tools to proactively support strong health as we age. Chronic disease self-management programs provide support to manage chronic conditions and to prevent life-altering falls. Through programs like A Matter of Balance, Tai Chi, and Drums Alive, we move from reactive to proactive prevention, helping seniors stay active and mobile. Next slide. As I mentioned, AAA's leverage Older American Act funding to expand services beyond the core services and to offer a broader safety net. Our non-OAA services often complement the OAA services and sometimes extend to adults with disabilities as well. Nationally, the average AAA offers more than a dozen additional benefits beyond the core services. Here in Missouri, these services vary greatly among our AAAs as they're designed based on locally determined needs as well as available resources. Excuse me. Most of our AAAs offer benefit health insurance counseling, which is unbiased and free. We partner very closely with SHIP as well. We provide trained counselors who help to navigate the complexities of Medicare enrollment, appeals, coverage issues. We offer support for low-income Medicare recipients with applications for MSP, LIHEAP, and SNAP. And we also assist with Medicaid enrollment and issues there as well. The Senior Medicare Patrol program provides outreach and support to prevent Medicare fraud and scams. And many of our AAAs provide tax assistance, ranging from assistance in filing taxes to help with applications for property estate tax credits like the Missouri Circuit Breaker and other tax credits that may be statewide or local as well. The Veterans Directed Care Program, VDC, is a program collaborating with the Veterans Administration and provides support for veterans in choosing their own caregivers and manage their own services. And Give 5 is a unique program to Missouri. Give 5 provides we call it a civic matchmaking to help soon-to-be or recently retired adults to find a right fit with a nonprofit to share and give back their talent and time in the community. We have many other services that I don't have time to cover all of them, but now I'm going to turn it over to Christy, who can expand on some of the really exciting new opportunities that we're exploring here in Missouri.
Thanks so much, Julie, and good afternoon, everyone. Goodness, I came from healthcare about 2.5 years ago to the AAA world, and I'm still astounded by all that happens in the area agencies on aging. So it was delightful to listen to you talk about all of the detail of what we do every day, Julie. Thank you very much. So because of that, many of us are positioned well to deliver those services across funding sources. So the Older Americans Act was never intended to fully cover every need. In fact, it's been level pay for many, many years. So AAAs across the country are working hard to find other funding sources to both meet the needs of the growing population, but also to think about how we partner with other folks in our communities like healthcare. So what you're looking at right now is a map of community care hubs, and in many cases, area agencies on aging are serving as community care hubs based on the network of subcontractors and community-based organizations they already work with to deliver the variety of services that you heard from Julie. AAAs are really unique in that they cover every corner of the state and as a result, every corner of the country. So they're well positioned to be able to deliver services for multiple funding providers. We are one of 70 community care hubs, and if you go to the next slide, we'll zoom in a little bit to Missouri. We're in a unique position in Missouri in that we really have the equivalent of 3 hubs, kind of bookend care hubs with Mark being a community support network in the Kansas City area. There is a forming community care hub in the St. Louis area, but then covering the entire state is the MA4 network, which is the association that Julie alluded to. So again, well positioned to do things like deliver meals to every corner of the state. And so we're looking for ways to expand that beyond traditional funding sources. Next slide. This is an overview of what that community care hub model looks like. Again, it's built on a network of service delivery providers. As Julie said, in some areas, that is the Area Agency on Aging. For us, we are a pass-through to the community-based organizations in our community that already provide those services. So we manage the funding, the contracting, the invoicing, the cybersecurity, a lot of the centralized backbone services that those organizations need to be able to focus on delivery of care and services in the community. So in our case in Kansas City, we represent that yellow circle, and in many cases, the MA4 network does that across the state. In this case, this is focused on healthcare providers and health plans, but there are many other federal funding sources and grant funding sources that we have pursued over time to deploy as a state with these services. So ultimately, the referrals come in from those funders to the community care hub, go out to the partners for the service delivery. Those services are delivered, and then data is shared back and forth with the funder in this case. Next slide. So this is the ideal workflow, and I just wanted to spend a quick minute on this because it's very easy to think of area agencies on aging and community care hubs as a set of individual disconnected services. And in reality, when you think about whole person care, many times it's not just somebody who needs a meal. As Julie mentioned, when we make that connection with folks in their homes, delivering those meals, we identify many, many other needs that need to be addressed. So ideally, we look to the community as a professional. If you think about a referral from primary care and healthcare to a cardiologist, they don't typically refer for one element. They refer for complete care of the cardiac system. And so increasingly, we need to view the community in that same way, where a referral comes to the community when a need is identified, but then the community is able to, through community care management, as Julie talked about, community health workers, which often serve in that function, is able to do a full whole person assessment, looks at all of those needs, not just one item that showed up perhaps on a social determinants of health screener. Then they are able to put together a person-centered care plan and work directly with healthcare if that's who the partner is, provide those services and share learnings back and forth, needs back and forth, make sure they get to medical appointments, for example, that we have a chance to address overutilization or chronic disease flares through supports that they may need in the community. So that whole person care is really critical in the community care hub and area agency on aging model. Next slide. So when I talked about statewide reach, there are a number of things that can happen outside of that workflow. We did have a large grant for about 7 years to deliver evidence-based programs, for example, across the state, which included chronic disease self-management, diabetes self-management. There are lots and lots of workshops there, including falls prevention and balance types of courses. Increasingly, we're working toward medically tailored home delivered meals. Right now, we meet pretty strict dietary guidelines for our home delivered meals, but we know there are things like older adults who can't have gluten or are vegetarian. And so, increasingly as MA4 Association, we're working on how we expand our meal options in the state. Benefits and navigation, you heard Julie talk about. Care transitions are a great opportunity considering the services that area agencies on aging provide. When you think about someone leaving the hospital, returning to their homes and being able to remain in their homes safely without a readmission, that's of great interest to the healthcare system. We have some shared goals and outcomes in that arrangement. And then other home and community-based services and shared services. So by nature of having a state Association of Area Agencies on Aging, we're able to work together and create some efficiencies so we're not all duplicating work in each of our regions. Next slide. This is specific to Missouri, one of the great examples of where the area agencies on aging are participating in some of that hub-like work. So the Transformation of Rural Community Health, or TORCH program in Missouri, was started in 6 communities, and area agencies on aging are at the table in those efforts to provide services in the community as needs are identified. We are optimistic that we'll be able to expand this work. Each hospital in this case is serving as the hub, so to speak, or at least the organization that is doing the assessment and then making the referral out to the community. Each hospital has a community leadership board. So in many cases, the area agencies on aging have been part of that community leadership board, and then are receiving referrals through an online platform to either directly deliver services or activate their network of community-based organizations to deliver those services. And as you can see on the right, there are a lot of shared outcomes and shared measures of success within that model. Next slide. This gives you a sense of the 6 initial sites. For us, Rhea County is our region, and so we work with Rhea County Hospital. Again, I think there has been a lot of good that came out of this model, and so I believe they will be looking to expand this across the state. Next slide. So finally, just wanted to share with you this long list of things that AAAs do. And so we have this year determined we need to really focus on some key areas to take a deep dive and to really grow programs, not to diminish any of the other programs, but to make sure that we are pouring our efforts into the expansion of some key needs. One, of course, is nutrition and that home delivered meals, medically tailored meals, the ability to deliver statewide and perhaps work with others in the state who would benefit from a home delivered meals program. And then caregiver support. As Julie said, this is a huge need. We talk often about approaching this caregiver crisis where folks are not only juggling young families, but also caregiving to older family members, but just having the connectivity and the respite care to be able to keep that pace. So funding is an issue for caregivers to spend their time away from work doing that work, but also the ability to just be healthy in doing that. So that's definitely a focus for us in this coming year. Reducing social isolation, we have always focused on that, but we hope to be even more intentional, especially as we think about people aging in place in their homes. Great if they can go to a senior center and have circles of communication and interaction, but especially as they become more homebound, this is increasingly important. So looking at different ways that we can do that, like telephone connections and digital tools. And then finally, increasing access to benefits. We know the cost of living, cost of healthcare, cost of everything is going up. So it's difficult as you age to think about living on a fixed income when costs are not fixed. So making sure that every older adult we work with has access to every benefit they may be eligible for. So that also is a focus for us, not only to find the programs for which they're eligible, not only to get them enrolled, but also to make sure that they stay enrolled over time. Next slide. And then this is just the map again that Julie shared with you earlier, the contact information for the AAAs across the state of Missouri. I just will share personally, if you live in Missouri, you're in a very lucky position that you have a very activated network of area agencies on aging. Sometimes I think our biggest challenge is the visibility of all of the great work that happens there. So we thank you for the time to be able to talk about that, to share the great work, the success, but also the ongoing need. These groups are working very, very hard to extend as many services as possible with the resources that we have. Next slide. I think we're getting close to questions. Julie, anything you want to comment on here in terms of the resource line? And
No, Missouri has a senior resource line. That 1-800 number is a great number to have in your pocket for someone that's looking for information about services. You call that phone number, it will prompt you to enter your 5-digit zip code, and it will automatically route you to the AAA that serves that community. You can also go on our website to find your local AAA and learn more about what the services are available. And we're just really happy to be a part of this network, the No Wrong Door Network as well. AAAs have historically been that front door for serving older adults, and we're happy to be working to expand that no wrong door concept across the state and across service delivery. And we're open for any kind of questions that you would have.
At this point, if anyone wants to come off mute to ask a question or use the chat, this is your time to shine.
great question in the chat around funding. So there's the Older Americans Act for the Area Agencies on Aging, which is the federal funding that goes from the federal government to the state and ultimately to the area agencies on aging, as Julie shared earlier. That's kind of baseline foundational funding. Then each state supports at some level. That is a varied amount in terms of state funding. Beyond that, we look for a lot of grants and a lot of other funding mechanisms. Julie, anything you want to add to that from a funding perspective?
Yeah, so about half of the counties, I believe, in Missouri have senior levy funds, and many of those senior levy funds, those are local taxes that support older adults in their communities, and many of those funds support services that the AAAs provide as well. But it's a constant challenge. Everyone who does this kind of work knows it's just there's no stopping to look for resources to serve our clients because the need just grows and the resources do not. So I think we're all in the same boat there.
Yeah, and while grants are great, if you work with grants, you know they come and go, and that makes it really difficult for the work that we do. For example, if you're serving 20 people with home delivered meals on grant funding that only lasts a year, it's quite disruptive and can even be harmful. So looking for sustainable funding is tricky, but really, really important to us. One of the things I didn't comment on heavily when we were talking about the community care hub model is that, of course, our first focus is on the client, on the person receiving the services. The great byproduct of the area agencies on aging and the community care hub model is that there's flow through investment to the community, to that infrastructure of services. So, for example, a healthcare entity may have a community health worker, which is wonderful, but they still need to refer to things like nutrition and transportation, and even perhaps community care management. So that ability for area agencies on aging to be a funding source to that social infrastructure in their communities, I think is really key. Any other questions or even suggestions for us?
Well, our contact information is on the slides. We're happy to if anyone has any follow-up questions as well.
Christy, thanks for that question. No, there are no income requirements. However, the Older Americans Act has asked area agencies on aging to prioritize populations of greatest social and economic need. So it's a little tricky because we don't do means testing, but we do try to find ways to determine who's at highest risk and be able to prioritize services there. Great question.
That's a tough one. Yeah.
Julie, anything you want to?
I don't know. I think that varies from each of the AAAs, but I get that question a lot. That's a tough one. There just is not enough funding for that to go around, unfortunately.
Yeah. And mobility, transportation is the greatest challenge. Not only is there a shortage of transportation, the ability to use transportation services, if you have a walker, for example, become even fewer in the community.
To get an assessment from a AAA, all you have to do is just call your local AAA. And again, you can use that statewide number to start out if you need to, or if you know your local AAA, call them directly, and they'll get you working on that assessment. Well, Catherine, I think we'll turn it back to you at this point. Maybe we can wrap up early today. That's always a nice thing, isn't it? But again, we're here for questions. Our contact information is on the slides that you'll get post after this meeting. So feel free to reach out anytime. And thank you for your time today.
Thank you, Julie and Christy. I did launch the closing poll, so I'll leave that open. Feel free to ask questions as you complete the poll and log off. We will give you about 20 minutes of your day back. Thank you for attending today. And as soon as the recording is ready, you will be notified so you can access the recording and the slides. Thanks for coming today.
Thank you.